Could you give us an example of some of the things that people don't realize that estrogen takes care of?
It also helps to build strong bones when the last thing you want as you're aging is osteoporosis. And the testosterone pills we use actually rebuilds bone. So if you have osteoporosis or osteopenia, the pellet I think would be your best answer. But estrogen, like I said, supports the collagen in the skin. It helps with mood, happiness. I could tell when my mother missed, she was back on Premarin back in the day, and I'd call her every morning and she'd be crying over something stupid. And I'm like, Ma, you didn't take your pill. Go take your Premarin and I'll call you back. I call her back in 30 minutes and it's, hello, when I'll drive in the world. She's a sunny personality, and for her to be crying over something stupid was just something's wrong.
Hi, I'm Linus Woods Mullins, and I love to help women to vibe, to be more vibrant, intuitive, beautiful, and empowered in midlife. So come on, let's vibe.
If you've been to any of my TikTok lives, or if you happen to be a member of the V.I.B.E community, you know I talk a lot about hormones. When I first got started in this business 19 years ago, I started because I had an anxiety disorder, or what was diagnosed as an anxiety disorder. I found out as I began to study more that it was just, that was not it. My anxiety was based upon hormones. And then all of a sudden, a whole new world opened up to me, and it really re-solidified my commitment to educating women about all the different things that are going on with their body and all the different ways they can address it. Because we do not have to be victims. No longer should we be going to the doctor's office, laying on the table and saying, okay, take a look at me, what's wrong with me? We're going to the doctor's office now with our spiral notebooks or journals and listing the things that are wrong. And we're not leaving until we get some answers. And if we get a prescription, we're going to know what the prescription is for, how are we going to take it, and what's the plan to get you off of that prescription, what are the side effects, all of those things. We're going to become advocates for our health. And I think that is so important. And that's why I'm so excited to have with us Carolyn, I hope this is right, I pronounce it, Zaumeyer. Is that correct? Almost? Okay. And she is wonderful. She has written a book called Are You Hormone Curious? Okay. And for over 3 decades, she's had hands-on clinical experience as a seasoned nurse practitioner. And she has out some crucial yet often overlooked information about the roles that hormones play in achieving vibrancy and also in combating the effects of aging. So thank you so much for being here, Carolyn, and thank you for sending me your book. I just loved it. I read it cover to cover, and so much of it was a validation because I've been studying hormones probably for 10 of the 19 years that I've been in business. I have several certifications around hormone therapy. So it's just wonderful to have you here. Welcome to the V.I.B.E Living Podcast.
Well, it's my pleasure. I just want to share the good news of bioidentical hormone therapy. I've written this book, Are You Hormone Curious? It's available on my website. You can get it for free. We'll actually mail it to you for no charge. So if you go to lowteflorida.com with Florida spelled out, there'll be a little box there that you can put in your address and we'll mail it to you. And I wrote the book just to share the good news because I've been providing hormone therapy for many years. And I just wanted to back it up with the studies and, really explain it so people could understand what I'm talking about.
Let's talk a little bit about that because for years and years, even though the studies were done, the interpretation of the studies were miscommunicated. And for years, hormone replacement therapy was black boxed. Many doctors weren't trained in it, and the gynecologists who were aware of it and trained in it perhaps were afraid to do it because no one wants to get sued. They're concerned about malpractice insurance and all these different things. And the sad reality was that many women ended up suffering and in some cases even dying as a result of not being able to have HRT. So what has changed since then?
A lot has changed. And from when I first started doing this, like in 1992, I think I started writing prescriptions for hormone. I feel like I've been swimming upstream. I've got so much bad information flying at me from patients and other doctors saying that this is horrible, this is painful. And I'm like, no, it's not harmful at all. And so I've been advocating for hormone therapy all these years. And then all of a sudden they lift the black box warnings that shouldn't have been there to begin with because they were misinterpreted studies that led to that. And so now everybody thinks, oh, hormones are, so let me write for hormones, but they don't have the experience or the training to do it properly. So you have to be very careful who you choose to prescribe your hormones to make sure it's the right dose, the best delivery system, and the right hormones.
Let's kind of do like a hormone 101 because that's where I start when I'm talking with my clients about what it is because so many women don't know. I know I didn't know. I had no idea. When they told me I had an anxiety disorder that was related to post-traumatic stress, and I thought, okay, that could be true because of how my mother died. She was 56 and she was hit by a fire truck on her way to work. It was a car accident. Very traumatic how I found out and everything else. Very traumatic. Now, the interesting thing was that the anxiety didn't show up until 20 years later. Now, I was 31 when this happened, and 20 years later, at 51, I started having this really bad anxiety. Now, of course, we both know, 51, that should have been the first signal to harm that I was talking to, because I talked to psychologists, psychiatrists, doctors, all that. None of them led with hormones. But as it turns out, many years later, and I did heal myself in other ways, but also my hormones shifted too, okay? But many years later, I found out that it was because of low progesterone. So let's talk a little bit about the different hormones and how they impact us.
Absolutely. The interesting, going to your story is that we've been using what I do, the hormone pellet therapy, for returning war vets and first responders because of the PTSD. It's not that it cures PTSD, but it helps with anxiety, depression, sleep, mood, relationships, energy, wanting to get out in the world and actually live and exercise and have a good life. And so we've used that as a treatment, which is fabulous, to be able to give guys their sleep back, the whole bit. But bioidentical hormones, they help with so many different things. Most of my patients say that they get a nice, delicious sleep, wake up feeling more refreshed, feel more like exercising, less anxiety, depression, sexual thoughts are more, sexual satisfaction is better, temperature swings, hot flashes, night sweats go away. That whole dryness is a quick repair, and even joint pain for many people is relieved. So you don't think of all those things as being hormone related, but they are. What we use for treatment is estradiol, and it's a very safe version of estrogen, and bioidentical, testosterone, and those two I use in a pellet, and that gives a nice steady delivery for 3 to 5 months. And then if they have a uterus, we always have to balance out the estrogen with the progesterone, and that can be from a regular pharmacy or a compounding pharmacy. Just because we don't want to build up of the lining of the uterus from the estrogen coming in. Did I answer your question?
Yes. So we covered the kinds of hormones that might be involved in hormone replacement therapy. Let's talk a little bit about delivery. You mentioned pellets, and I see on your website a lot of people are asking about pellets. What is this? And I'll share an experience that I've had. I had no HRT at all from the ages 50 to 67. Yes, I had none. And not that I didn't have symptoms, but the symptoms were attributed to something else, right? And the cold flash, the hot flashes and stuff, I managed in terms of what I was eating and exercise and things like that. So my symptoms weren't that bad. But when I hit the 60s, I began to experience some things. And it really got bad when I was around 67 and I was getting yeast infections. I hadn't had yeast infections since I was in college. And of course, back then in the 70s, we all kinds of reasons why that was happening, okay? You earned it. I'm like, wait a minute, that's not going on in my life. What is going on? It was so bad. And my husband was like, look, we're taking you to emergency because I was walking with my legs 5 feet apart. It was horrible. Go in there and have a male doctor. And he's like, you're in emergency because of vaginal itching. I said, yes, I'm terrible. I said, I'm pretty sure it must be a yeast infection. And I know I can get some over-the-counter stuff, but I want to find out why I'm having this yeast infection at this stage of my life. I'm 67 years old. And there was a gynecologist in the next room. She was doing a rotation in ED, her rotation. This is managed care, okay? She was doing her rotation. And he said, I understand. He said, why did we come to emergency? More than likely, you're low on vaginal estrogen. And she said, can I go ahead and talk with her? And he was like, yeah, because I'm going to see the big.
Yeah,
getting it all. And so, sure enough, she did have a yeast infection, so she treated that. But she also gave me some estrogen, vaginal estrogen, and that just changed my life. And as I went further on, I was still getting a little bit of itching and things like that. And she was saying, more than likely, you might need more than just a little bit of vaginal estrogen. You might need the patch or something like that, right? And so when I went to go talk with the gynecologist about it, she was not out. They didn't want to do that for me because at that point was I still 67? Yes, I was 67, getting ready to be 68. And they don't like to, they say, after 65, to do that. And I said, I understand that, but please understand that there's cancer doesn't run in my family. I'm not obese. I have not had any chronic diseases. I've never had any surgeries. I am a healthy female and have the body of maybe a 45-year-old, according to the doctors. They were like, because I'm 68 now, I'll be 69 soon. And so I'm willing to take this risk because the itching, the smell and all that, I just know that something. So it's interesting because a lot of doctors, they'll give you part of the information, but because I had information because of what I do, I knew what to say in order to get the help that I needed. So, because we're having this discussion, anything that you can give to the audience that give them some idea on how to advocate for themselves would really be helpful.
Yeah. First off, just to go back to your story again, estradiol or estrogen is a moisture hormone, and it helps with vaginal dryness. And if you don't bring it in as you age, you're going to be crispy and dry down there, and it's not comfortable as you went through. And same, it supports a collagen in the skin, helps with dry eye, helps with joint pain because it helps with the fluid in the joints. So that's estrogen and moisture. Talking to your doctors, you just need to find one that or provider that is open and educated and have a history. When I first started doing this, everybody in town was like, what is she doing? She's putting pellets where? What is that? And it was like horrible, everybody. But now all the doctors are getting on board with it because the black box warning was lifted. So all of a sudden hormones are okay. But you have a lot of doctors that are not trained properly or providers that are not trained properly or have the experience. So you want years of experience. People, I pelleted over 25,000 butts. I have people that fly in I have one woman that flies in every 3 months from Nigeria, Romania, 2 from Scotland, 2 from Hawaii, all throughout the United States and the Caribbean. But and the reason they come to me is because of my experience, not because I just started pelleting yesterday and, oh, you're going to be my third person. Let me see if I do it right. So you want to really scope out who you're going to. And talking to your friends is a good way of finding a good provider if they're happy with them. But if they're not, then don't go there. Keep looking. Keep digging.
Yeah, that's so important. I tell people all the time that if you find that for whatever reason, the doctor that you're considering going to just isn't a match for you, it's really like shopping for shoes. If shoes don't fit right, you don't buy them anyway. What you used to way back in the day.
They look good.
Oh, but back in the day, we were dumb and all that stuff. No, we're looking for something that's going to be a fit for us. And especially midlife women in particular are beginning to realize that, you know what, the things I used to do back then, just aren't fitting me now. And I'm not going to scrimp on something like this. I always tell them, if it doesn't fit, don't force it. Keep looking. What's the question should they be asking to determine whether or not they're in right hands?
What I would recommend them to do is to get out a notepad and write down what are the things that are bothering me. Is it joint pain? Is it vaginal dryness? Is it hot flashes during the day or night sweat? Hot flashes during the day are from not enough estradiol, where night sweats are from not enough testosterone. So you need to write out what is your symptom list. If you go on our website, you can find that. And just going on my website and poking around with your notepad, write down, you'll get ideas. You'll see what else could be hormone related. How's my energy? How's my mood? My mental clarity? And write those things down. And then you'll be able to make up the question to carry in, like you said, to your provider with a notepad. I never go to the doctor without a list. My poor dermatologist, I'm drawing pictures. I'm just handing her everywhere that I think there may be a concern. But if she didn't have that, she wouldn't have the guidance to find the things that are important. Strongly advocate that. And I used to do gynecology for about 30 years, and I loved it when patients would bring in a list because it's like they thought about it ahead of time. They're not just coming in there, getting things done, then calling me in a week saying, oh, I forgot to ask you this. Get it all taken care of. We love questions, or I do, but let's be smart about it. Let's get our time down so we can get it done. My book is a good place to start. You read through that. That may give you some ideas. Traditionally, back in the day when I started, the traditional thing for gynecologists when women would complain about hot flashes is to prescribe them antidepressant. They weren't. They go on an antidepressant, they'd feel like crap. They'd start gaining weight. Oh, you're fat. Let's put you on some phentermine. Oh, good. Get on phentermine. Your blood pressure's high. Great. Okay, now your thyroid's whacked, so let's get you on thyroid medication. Oh, you're still fat and having hot flashes. Your cholesterol's up. Let's put you on a statin. Oh, you're on a statin, so now we need to give you CoQ10. It's just like, why not treat the root cause, which is hormones?
Why did you mention that? Because, for instance, estrogen is responsible for over 300 processes in the body, and it can impact so many things. And what can happen sometimes if you are what I consider misdiagnosed and you have high cholesterol, high blood pressure, and they prescribe those medications, I want people to understand these are medications, of course, can be life-saving, life-affirming, but you're not meant to be on them forever and ever. You got to make some lifestyle changes or figure out a way to take less of them, because over time, other things start happening and you start taking medications for the side effect of the medications. And some of these things could be definitely solved with estrogen. Could you give us an example of some of the things that people don't realize that estrogen takes care of?
It also helps to build strong bones when the last thing you want is your aging is osteoporosis. And the testosterone pellets we use actually rebuild the bone. So if you have osteoporosis or osteopenia, the pellet, I think, will be your best answer. But estrogen, like I said, supports the collagen in the skin. It helps with mood, happiness. I could tell when my mother missed, she was back on Premarin back in the day, and I call her every morning and she'd be crying over something stupid. And I'm like, Ma, you didn't take your pill. Go take your Premarin. I'll call you back. I call her back in 30 minutes and it's hello, when all's right with the world. She's a sunny personality, and for her to be crying over something stupid was just something's wrong. She was missing that one little thing that she needs. And she's still there. She's 91 and still very hormone dependent, as I am too. If mine start to decline, my mood comes down, my energy, my sleep's disrupted. Just don't feel good. I say things I shouldn't say, and I'll never apologize.
I'm so glad that you mentioned that. I am so glad, because this is another thing that I hear all the time. I was in menopause from about 50 to 52 or 40, 50, whatever, but I'm fine now. And I'm always saying, no, please understand, once menopausal, always menopausal. You may not have some of the symptoms of being postmenopausal or menopausal, whatever you want to call it. I know there's some who used to say premenopause is before that 365, 66 days. Then you are one day where you're menopausal, and then the rest of the time you're postmenopausal. So, okay, however you split the hairs. But the bottom line is that what the message that I want to send is that it never ends. It does come back. And what happens a lot of times, and this is where the doctor should be coming in and educating people, they come to them in their late 50s or 60s with symptoms, okay? And they fall right within that realm of someone who probably hasn't had any symptoms for a while, and all of a sudden things start going haywire, and they'll start prescribing other medications without pulling the panels. And let's talk about things.
We'll return to our great conversation with Carolyn right after this message. Let me ask you, how often are you dealing with congestion, sinus pressure, or allergies and just pushing through it? If that's you, I want to share something that really made a difference for me. It's called Sonu, a drug-free, FDA-approved therapy that uses personalized sound waves to help open your nasal passages. What makes it unique is that the sound waves are custom tuned to your facial structure. So it's designed especially for you. When I started using it, I noticed a real shift, especially with that stuffy nose I used to wake up with every morning. It actually helped me breathe clearly again. Those gentle vibrations work through your sinus cavities too, calming inflammation, reducing congestion, and supporting natural airflow. And it even works with your nervous system to reduce swelling. No medication needed. If you want to check it out for yourself, click the link on my show page to learn more.
What kind of panels should be pulled? I say that all the time. People say, what are you talking about pulling panels? What is it? And what should they be asking for?
What we start with is a very comprehensive blood test, and it includes the red blood cells, white blood cells. You want to know that they don't have an anemia, leukemia, or infection. We do the chemistry, which is the sugar, kidney, heart, liver enzyme. We do the thyroid 4 different ways, not just the TSH like your primary care does. We really dig deep on that, and because the symptoms can overlap. We do, for women, testosterone, total testosterone, estradiol, and FSH. And the FSH is a real marker for menopause for me, and their estradiol level. The estradiol level can fluctuate by the hour, so it's not that reliable. And then I also check in on vitamin D, because over 90% of the people I test are critically low, like around 20 when it should be 60 to 80. And then B12, because that's an energy vitamin. And most people, one reason why people come see me is low energy. They're tired of feeling tired, because after menopause, it's just like they lose their mojo, they lose their energy, and they want to feel good and youthful and have that dim and vigor. And so that's what we try to bring back with the hormones.
It's interesting, too, because low energy is definitely one of the issues, poor sleep and all of that. Once I got the rest of the HRT, I was fine. I was sleeping better. I've never really had brain fog, but I do feel like I had more clarity of thinking. But I definitely wasn't crying at these silly commercials. And I didn't even know it was tied to that until I realized that I was. And I was like, okay, that too. So there's a lot of things that go on that we don't realize. What about testosterone? What role does testosterone play?
Testosterone is a happy hormone, and our ovaries naturally produce it. And it can start to decline in your late 20s, early 30s. And testosterone is inherently responsible for your libido, your sexual thoughts, sexual satisfaction, helps with the joint pain, helps with mental clarity, helps rebuild bone. There's a lot to do with testosterone, and a lot of people don't think of it because it's not traditionally thought of as a female hormone, but it is. We have more testosterone than estrogen, and we need more. And for me, it was a real game changer. For my energy, I was getting through the day, but in the evening, I was just like, oh my gosh, I wait to feed my dogs, walk them, and put my jammies on and pour a mug of wine. I was just beat. And I got my hormone pellet the first time. About 2 weeks later, I realized, hey, I want to go out. I want to do things. I want to on that list of things I like to do at home. For me, the energy was a big game changer, but testosterone is important. It's a hormone. It just gives you that spring in your step, your mojo, brings you back to where you should be.
Okay. And what about progesterone? What is progesterone all about?
Progesterone is a very safe hormone, and it's very supportive for the breast tissue. As a rule, we give it to women that have a uterus to protect it from the buildup of the lining in the uterus. But I have a lot of women with hysterectomies that request it as well because it has a nice sleep benefit. And it's natural, it's bioidentical, and you take it before bed and it helps your brain relax so you get a nice sleep. It's also very calming for people with anxiety. And so I have some people that will take it twice a day. We can get it in a rapid dissolve tablet that doesn't have the sleep effect, so they can take it in the morning for the calming effect, but not have the sleepiness.
Oh, that's very interesting because I think the progesterone, because of the estrogen, for the reasons that you mentioned, because I still have my uterus. The only thing that I've noticed is a little bit of grogginess in the morning that I never had before. That's the only thing. But I do have a solution for that. I stay on my feet for the first hour that I wake up. I wake up very early. I wake up at 4:30 every morning. I've been doing that since my first child, and I have 4 daughters, and I had them all close together, and I guess I just changed forever. I just can't sleep past 4:30 in the morning. And so I'm walking around the house, and I'm also driving down the cortisol levels because I'm doing exercise and I'm moving. And then I drink some warm water. I don't drink any coffee or anything like that, at least until about 2 or 3 hours after I get up, because I don't want to, I'm very aware of cortisol levels, and so I don't want to do anything extra. And so that seems to help. And I guess the reason why I'm saying this is because, first of all, I'm using myself as an example, okay? Because I'm definitely a case study when it comes to getting the wrong information initially. But also, I just want people to know that there are things you can do to deal with maybe some of the inconvenient side effects, because the benefits far outweigh some of the little things. Now, let me ask you this. Where do the adrenals come into play? Because I know women, and sometimes I hear medical professionals talk about drained adrenals, even though it is not in the diagnostic code. What is a drained adrenal? Or is that even real? And why do we need our adrenals not to be drained?
Yeah, I can't even speak on that one. You got the floor on that one. I don't even know what to say on that. Yeah, the adrenals are important with the cortisol and all that. And we're just doing testing on the cortisol levels, and that's important. You find a place that will actually test you, and it has to be done correctly at a certain time of day to go with what test you're doing. But we really haven't really implemented that much into my practice on the adrenals. So if we correct the hormones, we correct.
Yeah. Yeah, but it's something that I hear a lot of women talk about lately, and I think it's because they're listening to stuff on the internet or whatever.
Yeah.
But I also think that getting the information is the power, but acting on the information, that's what's really powerful. And I think a lot of women, especially these days, they have access to some of this information, but for some reason, it's difficult for them to actually act on it. So what can you help them with in terms of having that important discussion with their primary care physician or their gynecologist, and the fact that they think they might be approaching menopause, whatever? How do they bring it up? What do they need to be saying?
I think the first thing is, like I said, is to make a list of what you're actually feeling, because it's hard when you're on the spot at your doctor's appointment to come up with, oh yeah, I feel brain fog. You may have brain fog right then and you can't remember why you're there, but if anxiety or depression's number one on your list, rank them and say, because like when I'm doing a consultation over the phone with a patient, I always ask them, what are the top three things you would like me to zero in on? What are the top three things that you would like to see go away? And it's usually fatigue, libido needs to be increased, and sleep for a lot of people, which a lot of times is related to night sweats from the low testosterone. Zero in on yourself, and because the list of potential symptoms are a mile long. And so for your provider to give them guidance, tell them, because a lot of times I'll have people that be wanting certain things fixed, but they're afraid of the estrogen because they read the old studies and nobody's really explained it to them. And so I'll say, like, I had a lady that, oh, my family's all full of traditional medicine doctors. They're never going to let me do this. I said, okay, that's fine. I said, why don't we just take baby steps and maybe just do the testosterone only and see which of your symptoms we can get resolved with that. And then if we need to add in a whisper of the vaginal estrogen, we can do that for the vaginal dryness. Then some of the testosterone may aromatize the estrogen to take care of that. But we can take baby steps. And I'm always very conservative on my first dosing because I don't want to give them so much that they have any untoward effects and a bad experience. We can always add more in. Can't take it out if it's a pellet, but we can always add more in. The progesterone that you were talking about, how it gives you that sleepy feeling, the active ingredient in the progesterone lasts for 12 hours. So if you're taking it at 11 at night, you're going to feel groggy. You may feel groggy around till 11 in the morning. You can counteract that by taking it a little bit earlier if you could tolerate it, because some people, it makes them so sleepy, they just go to sleep right away. There's also what we call a rapid dissolve tablet that doesn't have that somnolence effect. So you could take the rapid dissolve tablet to satisfy your progesterone need. And if you're a good sleeper, have your night's sleep and wake up fresh. There's options. You just have to communicate with your provider. I love the progesterone, but I'm feeling too groggy in the morning. I can't get going. Okay, we can switch it to this. And you can even divide up the dosing. There's a lot of different options.
We talked about estrogen, progesterone, and testosterone when it comes to women. Let's talk a little bit about men, because I know that this was not a conversation I had with my mom or my dad, that when I got into my 50s or 60s or whatever, things began to not just change with me, but also my husband. What are some of the things that happen with men as they begin to age with their hormones?
It's hard to see because you'll see relationships really change, and it's not the person's fault. It's just they don't have those hormones. They don't have that loving feeling, and so they kind of drift apart. And for men, the number one reason I see them is for fatigue, that they just feel so tired at the end of the day. They've lost their mojo. They don't feel like doing anything. Things aren't working as well in the bedroom. So they want things to get a little firmer or last longer. There's many different things, because a guy with low testosterone, and it can start happening in the 30s for them as well. And if they played football, had concussion, head injury, that can make it go quicker. I had one guy who was in his 30s, had a lower testosterone than his father that I treated. So it's not necessarily age dependent, but when their testosterone tanks, they can feel grumpy, grouchy, just not themselves, and you don't even want to be around them. And so optimizing the hormones, and it's great to do it as a couple to get them back together. As you probably read in the beginning of my book, there are a couple testimonials from patients that are couples and how it really changed their relationship. And as Suzanne Summers I used to work with her, what she used to say is that if more people have their hormones optimized, there would be less war, there would be less divorce, and people would just be nicer to each other.
Wow.
And there is that nice factor. And sometimes the women will come in and say, I need my pellet. I've been so mean to my husband. I said, you can go home and tell him I gave you the nice pellet. Wife will be back in about 2 to 3 days.
Other kinds of body processes does the testosterone govern for men?
The testosterone really helps with bone building, like we talked about, and then helps with sexual response, helps with clearer thinking. There's studies showing there can be up to a 50% decreased risk of Alzheimer's utilizing the testosterone. I haven't seen the study, but that's what I've been hearing, so I want to look at that. Testosterone is very protective for the breast. There's a breast surgeon, Dr. Rebecca Glazier, that doing all kinds of studies showing how safe and how healthy it is to use testosterone pellets for women with breast cancer. She's actually putting pellets around the tumors and shrinking them. It's crazy good. For men, it's very protective for the prostate, where we were trained years ago that it caused prostate cancer to have a high testosterone level. which doesn't make sense because men have their highest testosterone early in their late teens, early 20s. How many of them had prostate cancer? 0. So it's when it goes down is when there's a problem, and it converts into dihydrotestosterone. So for men, it's very protective that way too. And it's just, I think that's a good thing.
And so many men don't know about this either. And then also there seems to be sometimes, and like I said, I don't work with men, I only work with women, but I'm just going by my husband's. It took me forever to get him to go and get checked out. And forever. It was, I don't know if it was a pride thing or what.
It was funny. When I first started doing this, I was trained in Texas. And there, for some reason, which is odd, the men were very open about it. You know, like testosterone went up on every corner, and they're like, hey, at the swimming pool, hey, what's your number? What do you use? And blah, blah, blah. Very talkative. I'm like, wow, this is great. I can't wait to take it back to South Florida. I get here, and the men are like, I don't know what my number is, but I'm sure it's just fine. Like I was insulting their manliness. And it's like, come on, let me at least do the lab. And once they see the labs, then the numbers, they understand it and they realize that there's a problem that can be fixed easily. And I had this girl, she called me and she says, Carolyn, you performed a miracle. I said, a miracle? I said, I've heard a lot of good things, but a miracle? This is fabulous. What did I do? And she says, you got my husband out of a chair. I said, what do you mean? She says, he used to come home from work, flop in the chair with the remote, and he wouldn't move. He'd eat supper there. He wouldn't move until it was time to go to bed. Now he's coming home. He's wanting to go outside and mow the lawn and doing things. He wants to go out. So I performed a miracle.
Wow, it's amazing how important these hormones are. And I am so grateful for this book. The name of the book is called Are You Hormone Curious? And it covers not just the need for women, but for men as well. And she talks about the science of hormone therapy for men and women explained. Carolyn, thank you so much. And for those of you who want to find out more about this book or get the book, please take a look at the show notes. All of her social media is there, as well as information about the book. And it sounds like you talk with women from all over the world. So anyone listening to this podcast would be very blessed and lucky to have Carolyn as their medical practitioner. Thank you so much for being here on the V.I.B.E. Living Podcast. It's been lovely having you here today.
And I feel like we could talk for hours.
Thank you so much. It's all of you for listening to the V.I.B.E. Living Podcast. It's been so much fun over these last few years talking to wonderful experts like Carolyn when it comes to the kinds of things you need to know about your body to help you to vibe, to be more vibrant, more intuitive, beautiful, and empowered in midlife. Thanks so much for listening. Have a fantastic day, and don't forget to vibe. Bye-bye, everybody. Thanks for listening to the V.I.B.E. Living Podcast. And don't forget to subscribe and comment and share this podcast. Have a fantastic day, and don't forget to vibe. Bye-bye, everybody.